Hello. I am so honored to be here with you right now. And three amazing midwives who you're going to meet in a little while are joining us to present. They each have meant so much to me personally. Each of them have taught me so much as mentors, and they are implementing our International Childbirth Initiative 12 Steps to Safe and Respectful Mother-Baby Family Maternity Care. So our presentation today is the 12 steps in action in the United States, Bali, Indonesia, and in the Philippines. And with me, and you'll learn more about them, is midwife Jennie Joseph, midwife Robin Lim, and midwife Vicki Penwell. So I want to take you, and I should say my name, I'm Debra Pascali-Bonaro, and I am co-chair of the International Childbirth Initiative. And if you notice, we use the acronym ICI, but I love to say it the French way, which is EC, which means we're here. So the EC was created through a partnership between the International Federation for Gynecology and Obstetrics, known as FIGO, and the International Mother-Baby Childbirth Organization. And both our organizations came together to create a comprehensive set of principles and steps to implement respectful maternity care and invite partner organizations to join us. So the ICI is based in the newest evidence. It's a living document. It's always updated as we get new evidence and insights. And we also emphasize that the mother-baby, and notice the spelling, they are one unit, no space between them on paper or in language, and family, that this is one unit. We are currently endorsed by 20 different partner organizations. So it's important to know that our initiative is grounded in the framework of human rights. And we know that too much disrespect is happening in maternity care all over the world. Many people that have had disrespectful care refuse to seek maternity care in the next pregnancy. Disrespect and abuse includes physical abuse, not obtaining informed consent for procedures, non-confidential care, non-dignified care, discrimination, abandonment of care, or keeping a birthing person or a baby at a facility for lack of payment. Disrespect and abuse happens in all settings. So this is our framework of the ICI. We also have founding principles, and these are really important to us because each of the steps is based on our principles. Advocating for rights and access to care, ensuring respectful maternity care for every mother-baby family, protecting that mother-baby family triad, and promoting wellness and preventing illness and complications, and ensuring timely emergency referral and care. We also support people's autonomy and choices to facilitate a positive birthing environment and provide a healthy and positive birthing environment as a responsibility of our caregivers as well, using an evidence-based approach to maternity health services based on a midwifery and a family-centered philosophies of care. And you'll see these foundational principles now reflected in each of our steps. Now, I do hope that you will visit our website, and on our website, you will see not only the short version of the steps that I'm presenting now, but there is a much longer, more detailed version of each step. As well as in the full document, you will see the indicators for every step. For time, I'm not going to be reading and going over the indicators, but I hope that you're taking note of them because this is an initiative that is a self-reflective process where not only are the providers and the birthing people, the women's, the families, and the community voices heard, but they're integrated into how evaluation is done on a local level. So let me start with step one. Treat every woman and newborn with compassion, respect, and dignity without physical, verbal, or emotional abuse. Step two, Respect every woman's right to access and non-discriminatory and free or affordable care with cost transparency. So this forbids any under-table payments, and no woman or baby should be refused care for lack of payment. Step 3 is routinely provide mother-baby family maternity care, integrating the midwifery scope of practice and philosophy that can be practiced by all maternity care professionals in all settings. So this is really important because we know that our nurses and our doctors can practice a midwifery model of care as well. Step 4 is acknowledge mother's rights to continuous support during labor and birth by providers and a companion of her choice. And we do go into the long version, the research and the evidence and the efficacy between having a doula as well added to that team. Step 5 is offer non-pharmacological comfort and pain relief measures as safe first options. And if pharmacological pain relief is available, explain the benefits and the risks. Step 6 is provide evidence-based practices proven to be beneficial for the mother-baby family through the entire continuum of care. And you can see the beautiful images. We're encouraging posters that are encouraging eating, drinking, walking, moving, tools, and upright birthing, and privacy walls. So this, again, is each step is very comprehensive. And step 7 is really the flip. So step 6 is provide everything that we know from evidence is beneficial. And step 7 is avoid harmful practices that have insufficient evidence of benefit that outweigh the risk for routine or frequent use in normal pregnancy, labor, birth, or the postpartum and neonatal period. And you can read the list on this slide. Sadly, as many of us know, too many places in the world are still using practices that are not evidence-based. This actually goes on, and you'll see the indicators here, and there's growing research that supports every single step, that's the avoidance of these items in step 7. Step 8 is enhance wellness and prevent illness, implementing educational and public health measures. Step 9 is provide appropriate emergency obstetric and neonatal care and transport when needed. And you can see this picture from Kenya is using one of the life wraps. And so this is not only about training of the staff, transport, but also making sure you have the latest drugs and equipment available. Step 10 is have a supported human resource policy in place for recruitment and retention of dedicated staff and ensure a safe and positive working environment. As many of you know, when providers are required to provide respectful care, but they themselves work in a disrespectful environment, it's really difficult. So this step for us was so important that everyone feels safe and respected, and all providers have that guarantee from their human resource policies. Step 11 is provide a continuum of collaborative care with relevant healthcare educators, providers, institutions, and organizations. And this is weaving through the entire community. So we're really making sure that there are mechanisms for this communication and fostering good relationships between all providers, facility, and community health providers. And step 12 is promote breastfeeding and skin-to-skin contact. So many of you are doing this. You understand the code with the International Code of Marketing of Breast Milk, making sure that everyone has good working knowledge and skills to support breastfeeding. And this supports the 10 steps to successful breastfeeding of the baby-friendly initiative. So this is from UNICEF and the World Health Organization. So let's just summarize the steps before you hear them in action. Disrespectful care remains a global challenge that can have a lasting impact on women, babies, and their families. Respectful care must be supported through transparent and equitable facility policies, open communication with all birthing people, the patients, and their families, routine monitoring and collection of feedback, both from birthing people and their families, and staff trainings to assure the delivery of up-to-date evidence-based care. So as we now move into action, it's truly my honor today to introduce you to midwife Jennie Joseph. And Jennie is a British trained midwife who fights to ensure every person has their healthiest possible pregnancy, birth, and postpartum experience with dignity and support. Jennie created the JJ Way, which is an evidence-based maternity care model delivering readily accessible, patient-centered, culturally congruent care to women in areas that she terms maternotoxic zones. Her focus and drive is to ensure that Black women and other marginalized people remain safe and empowered inside broken and inequitable maternity health systems that have become dangerous and all too often lethal. She is the executive director of her own nonprofit corporation, Common Sense Childbirth, which operates a training institute, health clinics, and a birthing center in Orlando, Florida, and is also the founder of the National Perinatal Task Force, a grassroots organization whose mission is the elimination of racial disparities in maternal child health in the USA. Jennie is the founder and a proud member of the Council of Midwifery Elders. She serves on the Advisory Council for the Congressional Black Maternal Health Caucus and is a fellow of the Aspen Institute. So I know that you'll join me in welcoming Jennie. I'm going to come out of our share mode for a second so that we'll be able to say hello to her.
Thank you so much for that kind introduction, and I'm so grateful and excited to be here sharing with everybody today about the International Childbirth Initiative, the ICI. My organization is called Common Sense Childbirth, Inc., and our work is informed by what we have learned about the impact of disrespectful care on mother-baby family. So we are transforming maternal health care in America's maternotoxic zones, because even though America is the most developed country in the entire world, the most resourced country, we have some horrendous outcomes, which reflect that actually things aren't so wonderful when it comes to care of mother-baby family. Our mission, therefore, has been to find these areas where women are suffering most, where families are having the poorest of outcomes and the worst obstetric care, and do something about it, just like we would in any other area of critical need. So the ICI 12 steps support our mission and our goals, and we practice those at the birth center, which is called the Birthplace, and the Easy Access Women's Health Clinic, which is a prenatal care, and postpartum care, and interconceptional care women's health clinic, where we take care of women who choose to deliver in the hospital, sometimes with midwives and most of the time with obstetricians. So we have a hybrid in that we work with women and families who are not comfortable in birthing out of hospital, but want the community-based care that wraps around the birth experience. So sometimes I just wrap that all up into one statement. We're in the business of saving lives. And our goal is the elimination of racial disparities in birth outcomes in the USA. And not everybody knows how bad those disparities are. So simply put, our babies are dying. Twice as many African-American babies are being born too soon, too small, too sick to survive their first year of life in America. So Black babies are more at risk by at least twice, in some areas, 3 to 4 times as many as their white counterparts. What we also know now, and what we've focused on in these last few years, is that the fact that women are dying too. For the longest, we were looking at infant mortality, prematurity, low birth weight as the indicators of the poor obstetric care. But in actuality, obviously, the mothers, the women, the people that are carrying those infants were in such dire jeopardy that those infants were being born premature. So now we are clear what's going on as we gather the data and we pay more attention, but I don't think we've come up with a solution. And it's interesting because when you look at ICI, the solutions are right there in front of us. So actually, if we want to employ those solutions, if we want to utilize the wisdom that is embedded in this document, we get this problem solved in a heartbeat. But sadly, we're at the stage where 2 to 3 women are dying in the United States. Again, the most resourced, the amount of money, billions of dollars changing hands in the medical care system. And yet, then we look at the fact that there are so many near miss, women who actually don't die. And that's a statistic that's very hard to understand, because how are you going to really capture the truth of that statistic? So sometimes you'll hear 50,000 per year, sometimes 60,000 per year. But I challenge all of us to really stop a moment and consider how many women, how many people actually share their near-death experience, their near-miss incident. How many women actually are telling the story of, yeah, I was discharged from the maternity ward via the ICU. I nearly died, but I'm still here, because when you're alive, you're not actually a statistic. Women don't share stories. We hold stuff, we stuff it, we manage, we get our postpartum depression and we carry on. So this is a statistic that may be hard to capture, but it is rife in the United States. And once again, the disparity is there. 3 to 4 times as many African-American women as white women are dying, and that is the problem. So yeah, along with that, and I know no one is shocked who's listening because we've already put 2 and 2 together, but mistreatment and this type of discrimination and the actual ways of being are the bigger culprits here. And 1 in 6 women are experiencing mistreatment in childbirth in America. People of color experience it more than most, with Indigenous women being the leaders, if you will, having the most exposure to this lack of respect, lack of dignity. Hispanic women, Black women, neck and neck almost, and white women, still a larger number of white women are stating their experience. And the top types of mistreatment are the same as mistreatment around the entire rest of the globe: being shouted at or scolded, refusing the request for help, violation of privacy, threatening or withholding treatment. This is important work. When we have qualitative and quantitative studies that show categorically what we already know and what women have been saying for decades, we really have no excuse not to act. So I want to quickly share a story because it's illustrative of what is happening in plain sight in a system such as the American maternity care system, where we have the technology, we have all the bells and whistles, we have everything at our fingertips for the most part. But there's something about the way we apply our resources, our technology, our medications, and also our skills as trained professionals. There's something about how we do that and how it's variable according to who or what, or structurally what is condoned and accepted. So in this couple of pictures here, you see a young woman who literally has just delivered a baby. And the backstory is that this woman came into the clinic at 39 weeks of pregnancy for a routine antenatal checkup, a prenatal checkup, and was looking really uncomfortable and miserable, but you know, term, how it can be. So we weren't too concerned until we went ahead and did her exam, checked her cervix, and she was 8 centimeters dilated. So this is a woman who had chosen hospital delivery. So she knew that she was planning to be delivered in the hospital. So we duly agreed that we best get her there really fast. And we called an ambulance to get her transported because she was that close, she was in transition. So my heart was like, let me not just put her in the ambulance and send her on her way. I jumped in the ambulance with her, and sure enough, as soon as we got going, the baby was born. And in the first picture, you can see the shock and the, like, what happened? Like that face. But I got the baby skin to skin, and by the time we got to the hospital, we got her in the hospital bed, she was still able to hold the baby skin to skin while everybody ran around in circles, all frantic because the baby had been born in the ambulance. And you see here, this next picture, set of pictures where baby is pinking up beautifully, baby is beginning to do that breast crawl, baby is doing wonderfully, and look at mama's face. From total shock and horror of, whoops, my baby fell out in the ambulance, to, I'm okay. And I put this series together because I thought it was just so poignant. But here's the other piece, and this is where you understand the impact of ICI, the impact of applying these steps universally. This woman wanted to breastfeed her baby. The child was bonding well, was so comfortable, was absolutely regulated to being out and being next to his mom, skin to skin. By the time this mother was transferred upstairs to the labor and delivery floor, there was an argument ongoing between the junior doctors and the resident doctors and the attending doctors of who was going to deliver the placenta, because in America, delivering the placenta connotes who gets paid. And while the argument was ensuing, the nursery nurses came, took the baby off the chest, and said, this child needs a bottle. Mother had already asked for breastfeeding, was saying that she was going to breastfeed. She was getting ready. The child was clearly getting ready. The nurse literally in the labor and delivery room put the bottle in the baby's mouth. That relationship was never fixed. The woman never established breastfeeding. So what was proof that physiological birth works, that with support you can rally, with skin to skin the baby can be settled and regulated, was destroyed in a hot minute. Why? Because a staff member and other folk around her created chaos and confusion and power struggles, which ended up with breaking that relationship. So what does culturally safe perinatal care look like? And culture is not always language. Culture is ethnicity, but culture is tradition. Culture is respect. Culture is so many things wrapped up into one thing in terms of how it relates to the mother-baby family. We knew of a long time that we were doing trauma-informed care. We hadn't captured it, we hadn't documented it that way, but that's what we were doing. And one of our most important pieces is making sure we don't keep re-traumatizing traumatized people. And we also knew that we had to consider traumatized staff, people who inside of these environments that are toxic are then stuck with the moral injury of having to operate inside of that, knowing that they don't feel comfortable with it, but don't know what to do about it. So we also engaged the staff members in how they can manage the situations that they're working in, whether it's something that they want to do or not, whether they can speak up or not, and how to manage themselves. And so we found that working that way, using the trauma-informed approach, that we can mitigate the structural and the environmental and the pop-up toxicity, which is, we believe, killing our mothers and our babies. So toxicity isn't always in social determinants of health, poor neighborhoods, low-income areas, violence. Pop-up toxicity can happen, as I just illustrated, in the middle of a hospital. How ridiculous. So we're looking at this overall model, I call it the JJ way, because what we considered was, could it be possible if we created a culture and environment that supports all pregnant people, that we could make the difference for their health, for their baby's health, for the birth weight, for the breastfeeding rates, for women who are at risk. And the women that are at risk in America, those that experience the maternal toxicity that comes at them just because of who they are, not always because of where they are or how their socio-economic demographics are in play. So we incorporated the ICI standards throughout our practice, and we are doing that in the birthing center, which is a freestanding birthing center for low risk and healthy women, but also in the easy access clinic environment, in the outpatient clinic environment, because that's where many of the women are more traumatized, have less support, and just as easily as I just illustrated, the rug can be taken out from under them. So the safe and respectful care with dignity, the compassionate care, the culturally sensitive care, the non-judgmental care, that is how we implement ICI standards. And this is what we get. This is a group of our postpartum moms who gathered together for a meeting at the clinic, and just look at them. This is not a common picture. It's not that common to see healthy women of color smiling. Look at the baby's thighs. They've all got rolls. I mean, these are breastfed, healthy, beautiful babies. And this is what's possible when you use these ICI steps. I put this picture in just to illustrate, because again, I talked about, working with the staff and helping support them so they too can be empowered. And the step 10, step 11 addresses the impact of how having respectful protocols and working with staff, making sure that they understand why and how the work they do is powerful in terms of saving lives. They in turn become empowered and feel that same dignity and same ability to practice their craft. And these are some of the women that work with me in various stages. Some are just paraprofessional. One is a nurse practitioner, one is a medical assistant, but they also enjoy the work and they are able to implement the 12 steps as we go along as well. So really what I'm trying to say is when you can craft those steps to match what you're doing and recognize how important that implementing them is to not only the mother-baby family, but to your staff, your team, yourself, and to model that with these types of interventions, we literally can transform maternal health and we absolutely can save lives. So thank you.
So I am honored to introduce another amazing midwife. Ibu Robin Lim is a midwife, a doula, a grandmother, and founder of the Yayasan Bumi Sehat Healthy Mother Earth Foundation and WADA Women, Children, and Hope Foundation of the Philippines. She spearheads the operations and funding efforts for 4 community health and childbirth clinics in Indonesia and 2 in the Philippines. Her passion is protecting the human rights of mother-baby, especially in high-risk, low-resource settings. Robin has implemented gentle, respectful, skilled childbirth protocols in disaster zones in Aceh following the 2004 Indian Ocean tsunami, in Padang, Jojo, Lombok, Palu, Haiti, and Nepal following devastating earthquakes, and Leyte, Philippines in the aftermath of a Category 5 typhoon that left all the people in the region homeless. Ibu Robin's team in Bali facilitated safe childbirth options for pregnant mothers during the eruptions of Bali's volcanoes in 2018. And in 2019, Robin traveled to Bangladesh to help establish loving childbirth protocols for the Rohingya refugees, and also helped Hope Foundation by teaching at the first ever midwifery conference for midwives in Bangladesh. Ibu Robin has authored many books in the childbirth genre, and Robin's support and inspiration are her husband, Will, and her 8 children and 6 grandchildren. So welcome, Robin.
Selamat pagi. Good morning. Hi, Debra. Hi, everyone. It's so exciting to talk about EC because it's really what we need to use as our touchstone so that we can keep coming back to that kind of care. So this is a story. I thought I would tell stories. This is Sapana in Dading, Nepal. She came to us in advanced labor with her second baby, having lost her 2-year-old son, her parents, her husband's parents, and their home in the earthquake. And she said she didn't want a baby. And her husband was still working on a cruise ship. They didn't allow him to come home. And so here she is at that moment of birth. And she gave us permission to share this photo taken by one of our beautiful Nepalese translators who later became a midwife in our education program. But Sapana means dream. And she reached for her baby and she fell in love with him even before he was fully born. He was just born up to here and in a tent. So it can happen no matter what the setting. That magical healing birth experience for any mother, sometimes when their trauma is so profound, you wonder, how can we hold this mother, hold her heart in her hands and her body and her soul through this experience? And this is a really great success story. Okay, next slide, Debra. This is my daughter, Zoe, who just on the 30th of July this year had a beautiful vaginal birth after a belly birth. She had a cesarean with the first baby. It was an emergency in California. The climate crisis is causing a lot of problems with placentas in California, according to the researchers there. And her baby's placenta, her first baby's placenta did begin to go into abruption. We were prepared for emergency transport. This is one of the things, it's one of the steps, is to be prepared to give emergency transport when it's necessary. And my grandson Bear was safely delivered with a lot of traumas in the hospital because of my daughter's race. She was accused of being on drugs and they wanted to take the baby away or wait for the drug test before doing the necessary cesarean. Fortunately, we were able to push it and get the cesarean on time before we had any damage or harm to my grandson Bear. But you can imagine the trauma. And then in this time of COVID, she planned to come home to Bali, Indonesia, to be with her family and to be in a trusted birthing environment for her VBAC. But the airports closed, and she was not able to travel home. She's also a doctor of traditional Chinese medicine with a PhD in reproductive health. So she knew well what had happened to her and what she was facing. And by a chain of miracles, I was able to go and be with her at my first daughter's home in Austin, Texas. And we had a beautiful VBAC. And it was not an easy birth, but it was incredible. And this baby had her cord around her neck 5 times, very tight. And we did not clamp or cut that cord. We were able to unwind it. And it just shows what really good family support. Cassandra Jha, who's a beautiful midwife in Austin, Texas, she was with us, and I can't thank her enough. And I can't thank my family enough and my daughter for being so brave and so wonderful. So here's an example of a VBAC in my own family. Okay, next slide. This is Budi Astuti. She's a rising star in the midwifery world. And I hope that when ICM happens, many of you can meet her. She she's from the island of Lombok. Her family home was absolutely and utterly destroyed with her entire village during the giant earthquakes in 2018. We were actually together for the second big earthquake that later that year, a couple of weeks after the first one. This is a mother who lost her home. She lost most of her family. And I just love the smile on her face under the hand of Budi's care in a tent. Because of Budi and our work together in Bumi Sehat, she has been able with Direct Relief International to build a clinic which is now open that also does community medicine, but has a focus on childbirth and is an EC site as well. So we are so proud of Budi. She also traveled with us to the Rohingya camp in Bangladesh. Next. This is Budi again. This is her helping one of the women in the Hope Field Hospital to breastfeed. Just an amazing rising star in midwifery. I can't say enough about her. She's just beautiful. She recently was quite traumatized when her husband suffered from COVID-19, and using the heritage herbs that are weeds in our garden here, he was able to get well quickly. And she and her son took the herbs preventatively and did not get the virus. So she's amazing. She's been through a lot. She also had a placenta previa with her first baby, or a placenta that wasn't detected as previa until it abrupted, and that baby was lost to her. So she's suffered great loss. She has a son that's 13 years old now, and she's taken her pain and her own sorrow and her loss to the next step to serve women internationally, especially on her own island. This is Lombok. This is the midwives were called, whoops, I don't know if you're seeing that. The midwives were called from Budi's team, from Bumi Sehat Lombok, to come to this mother who, with her third baby, could not move and had no transportation, and they arrived just as the baby was born, and they're doing postpartum care. This is her home. So it's not uncommon in the places where we serve to have mothers that really they need service of all kinds, and they need food, and they need service without judgment. Okay, next. This is what I call the circle of support with the mother in the middle. I know Dr. Iftikhar Mahmood from Hope Foundation in Bangladesh calls it the golden chain of support. Because even the poorest women there have a tiny golden chain, and they're in the middle. And so if we give our circle of support and put the mother in the middle, this is in Okinawa, you can have an incredible birth experience no matter how many challenges. This is the mother who achieved pregnancy after the age of 40 and lost her first baby, and then this is her second pregnancy. And because she found a beautiful beautiful birth center, and with an incredible staff in Okinawa, she was able to have an incredible experience. Okay, next slide. This is Putri. She's the daughter of the midwife in the middle with her hand up in the orange shirt. She's had a beautiful baby, and you can see the placenta still connected the next morning. That's her midwifery sisters. Her doula there on the far right is an American, young, beautiful American woman named Katie. These are all part of our team in Bumi Sehat Bali, and we just had such a beautiful birth. And I will say that this mother, probably due to her nutritional status, and we have a lot of this, we see a lot of this in Bali with the Balinese women, she actually suffered a 4th degree tear, and we were able to fix it there at Bumi Sehat without a problem. It was really something with her mother there. I had to ask her mother to step outside because I said, when this looks like a 1st degree tear, you can come right back in. It's up to you, but I would just prefer that. And that was during an hour where 5 babies were born. This is Ibu Yos. Ibu Yos is currently in quarantine with COVID-19. Her husband is very sick. She's not as sick. Her entire family is in government quarantine. She works at a public health center as well as at Bumi Sehat, and that public health center had an outbreak of it, and every single healthcare provider got it. But look at Ibu Putu's face. She has just had a 4-kilo baby for her first child, squatting on the floor in the arms of Ibu Yos, and just what a face. This is what we are, this is what we live for as healthcare providers, as birth keepers, as doulas, as midwives. We really live for that opportunity to give the mother and the baby this first embrace. That's just the most important thing, I think, the foundation of peace on earth. Okay. Here's a really, you know, I like the way we say high touch protocols. Thank you for that. Here's the ultrasound machine sitting turned off, and the mother Ellie the day before she has her baby. And I just wanted to put my ear on her belly, and we do that routinely at Bumi Sehat. We do put our ear on the pregnant mothers' bellies, the midwives, and we teach their partners. And not all families have a mother and a father. Some families have a mother and a mother, or families come in all kinds of shapes and sizes and colors. And but we teach the mother's partner and the children to put their ear and listen to the baby. And it's one of the things that just, to me, says, I believe in you, to the mother. And that is so important. It's such an important part of to give prenatal care, not prenatal scare. Okay, next slide. This is, you'll recognize this, Vicki Penwell. This is the tent that Vicki's daughter actually brought to the Philippines during the disaster. And it was used as a birth tent. The first 13 months, 777 babies were born, most of them in that tent. This is Lorena. She's a midwife from actually Camote. She's now going on to open her own birth center with some help from us. But here she is. It's just the moment where the baby's been born, and we're just giving that mother a pregnant pause to reach out and take her own baby to her heart. And Lorena always looked to me like a supermodel. She would wear lipstick in the disaster zone every day. And one day I asked her, I said, you know, you show up here looking beautiful, like with lipstick on. And she says, this is not for anybody except the mothers in labor. She says, it's not for a man. It's not even for me to look in the mirror and say, I'm beautiful. She goes, but I am. But she says, this says to every woman who comes in here, I love you. And I thought that was just incredible. Okay, next. This is Farida. Farida in July died from COVID-19. This is her making a home visit on a remote island on the lake, where nearby in Sentani, Papua, nearby where she served her community. She served several communities because she would go and make home visits. She was part of our Angel Hiromi Bumi Sehat Papua team. In February, she spent the entire month living in my house, so it was quite a shock that she went to a family funeral, and they feel that it was somewhere on the ferry that she contacted the virus. And yeah, she passed away, and it has been a shock to the community. But I will say that this woman always lived her passion. She loved to wear red, and she loved to serve MotherBaby, and she would do it day and night with so much courage. So it's a huge loss, but we just wanted to mention her today. Okay, next. I think this picture says it all. Oh, and here's a family in the time of COVID, the midwives wearing PPE, and the husband even wearing a mask. And this mother had just moments before asked that midwife to check her, and the midwife kind of looked down and could see that without having to do a vaginal exam that baby was bulging. And she's just taking a break before she decides to push her baby out. That was her first child. Beautiful, beautiful, Ibu Eni. This is our team for the Bumi Sehat Bali project. It's a big team. We have lots of midwives. We have 3 doctors. We have a big housekeeping team. We have cooks. We have drivers. We have gardeners. We have nurses. We also have the youth education center, and we all work together like a family. And this was a particular team building. This is only half the team, actually, because this team also supports the other clinics in the Philippines and in Indonesia to make sure that they all are running smoothly. They're just an extraordinary family. I'm really honored to be one of them. It's an incredible experience working with these people, so devoted to this vision and so excited about ICI and hoping to see it implemented in Indonesia as well as the Philippines. That will be our challenge and our blessing to implement it. Okay.
So thank you, Robin. And we're going to introduce our next midwife. It's just amazing, right? Each person has so much to offer in how they implement care. And Vicki's going to take us even further. Vicki Penwell is a licensed midwife. She's the founder and executive director of Mercy in Action Vineyard, Inc., responsible for establishing birth centers in the Philippines, where more than 16,000 babies have been born since 1991 at no cost to the parents and with outcomes 4 times better than the Philippines' national average. She also serves as executive director of the Mercy in Action College of Midwifery, a Bachelor of Science midwifery college accredited in the U.S. Vicki has a master's degree in midwifery from the U.S. and another master's degree in intercultural studies from the Philippines. Vicki lives with her husband of 42 years in the Philippines, traveling to teach midwifery around the world while still attending births and responding to disasters on occasion as needed. So welcome, Vicki.
Thank you.
And we will.
Thank you, Debra. I'm pleased to be here today. I'm presenting on how the steps of the International Childbirth Initiative drive patient outcomes and provider satisfaction in Mercy in Action's birth centers in the Philippines. So our logo and our motto is Safe Motherhood and Child Survival, one good birth at a time. And our methodology to achieve this is a model of providing maternity care based on the principles and values of the 12 steps of the International Childbirth Initiative. These steps are met in all of our midwife-led birth centers at all times and are the focus of our after-action reviews, our ongoing education, and they form the basis of any decisions regarding the delivery of maternity care in any setting, including emergencies, disasters, and at the moment, a pandemic. So it was important to me while I was preparing this presentation to give voice to the midwives who worked tirelessly beside me to implement these 12 steps. And I just wanted to acknowledge that without their full buy-in, enthusiasm, and belief in these steps, and the real trust that these steps can make birth better for everybody, for the mother, the baby, the family, and the providers, we would not have achieved the success that we have in these past 16,000 births. So let's hear first from Marlene.
Hi, my name is Marlene Dumalaon. I love working at the birth center wherein the International Childbirth Initiative, the 12 steps are being implemented. I really do believe that being a midwife, we should treat every mother with compassion, with dignity, and with respect in every prenatal, delivery, and postpartum period.
So this first step spells out the details of what respect is. And that includes informed consent, shared decision-making, and culturally safe care. But if you look closely, you will find that respect is woven into every inch of the fabric of all 12 steps. And how can we tell if the staff is giving dignity to the patients? Well, one sign is the smiles. This picture is of a pregnant woman and her midwife at the end of her prenatal visit. My mentor, the late Elizabeth Gilmore, used to say, Vicki, I can just tell you're getting great outcomes in your birth center without looking at your outcome stats because all the women here are smiling. I wonder when researchers will start measuring smiles and make a direct correlation to safer birth. Next, let's hear from a midwife who has worked with Mercy in Action since 2006.
Hi, I'm Imelda and I am a registered midwife. I love working at a birth center where International Childbirth Initiative 12 steps are used because it helps me fulfill my responsibilities as a midwife with integrity and excellence.
The second step is crucial to social justice. This step reads, provide free or affordable care with cost transparency. In our interpretation, we believe that until the crisis in maternity care is over and both mothers and babies stop dying of preventable causes around the time of childbirth in shockingly high numbers, then pregnancy must be the ticket in the door of maternity care at all levels. Pregnancy, not money. It's still normal where we are for women in labor to be turned away from hospitals if they can't pay cash at the door. And yes, you heard me right, I said in labor. And if they do get admitted in a true emergency situation, they are often not allowed to leave the hospital until the full bill is paid. And they're sometimes held there against their will for days, weeks, or even longer after giving birth. I want you now to meet a dear woman who's not a midwife, but a mother of 8 children who suffered much abuse giving birth in the first 6 children before she found Mercy in Action, and she now works for us as an assistant and community health worker.
Hi, I'm Janet Celeste Kaamik, and I love working at the birth center where the International Childbirth Initiative 12 steps are used to. Because I am a mother of 8 kids, I know the feeling of being pregnant is so sensitive. They need to feel the love and respect and safe giving birth in the birth center.
What I love about these 12 steps is that steps 3 through 8 protect physiologic birth. So we have several steps here that are protecting the normality of pregnancy and birth. And we know from 30 years experience working in the Philippines that simply being an out-of-hospital facility or hiring midwives does not keep birth normal. Healthcare providers are a product of their own education, and women are influenced by their culture. And if everyone is used to being abused and disempowered, they will accept that and they'll continue the cycle. However, we find that using the 12 steps helps keep everybody focused on how truly wonderfully made is the human body and the reproductive system when it's allowed to function without harmful interventions. So I want to explain where this phrase came from. In the 1980s, I had a chance to study the Dutch midwifery system in Holland, and they used the expression I borrowed here, under her own steam. Empowered women give birth under their own steam. And you can see from this picture how proud they are at the end of knowing that they did it. Nobody delivered them, they did it. And this empowerment will carry over into her parenting and her child raising. And now I'd like to have you meet one of the midwives who's helped us at Mercy in Action to empower women for more than 25 years now.
I'm Cecil Manawis. I'm a midwife, and I love working at the birth center where the International Childbirth Initiative 12 steps are used to, because for me, every pregnant woman has the right to treat well and to receive a right care and respect. And I can freely share my knowledge to every mother about pregnancy and birth, and also this is the place where they can feel that they are loved.
So I mentioned in the last step that steps 3 through 8 protect the physiological birth. But what's so powerful about the 12 steps together is that steps 9 and 11 are so vital to have in a document like this, because it's not enough to just champion natural birth and promote dignity and respect if you can't save lives in the process when things go wrong. So these steps keep birth safe when something in the pregnancy, birth, or the postpartum period deviates from normal. And here we're showing the use of the NASG, an anti-shock garment that's used as a resuscitation device after postpartum hemorrhage to reduce the risk of shock. At Mercy in Action, we spend equal time on both ends of the spectrum. We do a lot of discovering how natural and hands-off birth we can be when birth is working, and how well we can protect natural birth. And we're also constantly upping our game and responding to complications and emergencies to literally protect life when it comes to that. Now, in the next step, I want to talk about something surprising that also leads to safer and healthier outcomes. But first, I want you to meet the youngest midwife member of our team and enjoy her enthusiasm in this next clip.
Hi, I am Rosan and I am a registered midwife. I love working at a birth center where the International Childbirth Initiative is used because the client have experienced excellent care from antenatal, labor, birth, and postpartum. I am so happy that the birth center here in Olongapo is using the 12-step of ICI.
Wasn't it fitting to hear from Roseanne right before I talk about happy healthcare workers? Yes, that is step 10, providing a respectful, safe, and positive work environment for the staff. So encouraging the providers is key to all the steps working, and behavioral modeling is crucial. If there's a built-in culture of respect toward all members of the healthcare team, if they feel themselves empowered and cared for, then they in turn will usually act respectfully and carefully with the patients. But beware, for the reverse is true too. And we have seen, and people have really studied, how nurses, midwives, medical students who are at the low end of a pecking order or who live constantly in a toxic environment of bullying will act out against the helpless patients. And this oftentimes plays out very dangerously during labor. So at Mercy in Action, we're very determined to break that cycle. We deliberately forego the normal hierarchy, and we really believe in letting everyone have a voice. When we do after action review, everyone shares, from the most senior member to the doulas and the people that might be mopping the floor. Everybody gets to have a share. So now I want you to meet somebody for this last step who is a passionate breastfeeding advocate on our team. Now, she is a mother of 4 who nursed all her children successfully and very long-term in a culture where this is no longer the norm. She's not a trained medical worker, but she may be the most important member of our team.
Hi, I'm Heather Agi. I love working at the birth center where the International Childbirth Initiative 12 steps are used. I love to communicate with the patient and encourage them to breastfeed their babies and to tell them the advantage of breastfeeding.
So the final step of ICI is the 10 steps of the breastfeeding initiative. And a global expert I heard talking once, I've never forgot it, said there are no silver bullets in our work in medicine, but breastfeeding comes close. And that is true. If we only had 1,000 people like Medi to send around and talk to all of our patients and their families about how important it is to breastfeed. We know from studies that getting that early colostrum in the first hour of life is directly correlated with child survival. We know how important breastfeeding is now. We're learning every day how it even protects the health and prevents cancer in the mothers and prevents heart problems and all kinds of benefits of breastfeeding. But we feel we don't need just more policies to support breastfeeding. We really need a staff who believes in those benefits with all their heart, and that they'll convey that in a very powerful way to the parents who do want to do the best they can. They oftentimes are just tricked into thinking that bottle feeding is better. So we know we have better survival. It's a major key to survival. So all the steps together add up to this one good birth at a time that leads to great outcomes, to actual survival, and to very, very high levels of satisfaction on both the part of parents and providers. I wish I had time to read you all the kind things that we have ever recorded that have been said to us by parents, every note that's ever been written, every words that were sent, thanking our staff, the parents thanking them for being so kind. And every time that happens, every time the staff gets thanked for their great care, whether they saved a life or whether they did hardly anything and let birth unfold, the parents, every time they thank them, that reinforces the staff's desire to continue to follow the 12 steps and to do even better at showing love to those they serve. So we've incorporated these standards into every provision of care at every level. And as you can see, we don't hide it. The posters are up on the wall in all of our facilities in huge letters. And here I want to let Narissa tell us how they teach them to the patients, if you can play that video.
We incorporate teaching the International Childbirth Initiative into all our prenatal education so that the women will understand their rights in childbirth.
And it was Aristotle who first said, the whole is greater than the sum of its parts. And that ancient saying perfectly defines the synergy of a birthing team wholeheartedly embracing and doing these 12 steps of ICI. The whole is greater than the sum of any one of those 12 steps alone. For anyone who's ever played team sports, it echoes the team acronym that stands for together, everyone achieves more. And this is a picture of the birth center that Mercy in Action helped rebuild for Narissa after the devastating typhoon of 2013. Destroyed her birth center and almost took her life. And now it is a thriving community center and a beacon of light in this recovering community. And I just want to say how proud we are of every one of our team members and how hard they work to actually put hands and feet to these 12 steps, that they take it off the paper, out of the whole realm of a good idea or a philosophy, and they walk it out every day. And I've got one more slide. I just want to take a moment to acknowledge that at the time we're recording this, we're in the midst of a terrible global pandemic, that just yesterday we passed the mark of 1 million people dying worldwide of this COVID-19 with no end in sight. And I wanted to share this picture and quote because Imelda just sent me this picture yesterday with these words. She wrote, "Pandemics can't stop us from giving good quality care to our clients." And now more than ever, I believe we need a framework for excellence in the provision of maternity care to mothers, babies, and entire families. And we need a framework that will stand up to the test of time, but be flexible enough to go to disaster zones or to go through a pandemic with us. And the International Childbirth Initiative is that framework. Thank you.
Thank you so much, Vicki. That was incredible, and I loved hearing all the midwives, and Robin, your stories, and Jennie. Each one of you have contributed so much by taking these 12 steps and putting them into action in your practice, in your community, in your setting, in your centers. So I want to invite everyone that's here. I hope that you are as moved as I am in hearing their words and everyone's voices, seeing those smiles. And I hope that you'll visit our website, icichildbirth.org. If you are a provider working at a facility and you'd like to become an implementer, just send us an email off the website. We also hope you'll join our mailing list. We're going to be starting to send out more regular emails featuring our sites, these 3 sites and others, as well as we have some webinars coming up where each step will go into detail on how you can implement it. So please join our mailing list. Again, our website, icichildbirth.org. And we are brand new to social media. We have just created an Instagram account. We should be starting to post in just the next week or 2, and you will see pictures because the first features will be these 3 sites. So we'll be visiting Jennie Joseph, Vicki Penwell, and Robin Lim in each of their centers. But please tag us. Let us know what you thought of this presentation. What are your thoughts? And get involved. This takes everyone, and I love your acronym, Vicki. It really is a team, and you're all part of the team. We need everyone to come on board and make change happen. So I'm going to stop my share right now and give everybody an opportunity to see all of you one more time before we say goodbye, and offer, if there are any last thoughts from any of you, feel free.
I just want to thank you, Debra, for all the work that you did with the original IMBCI and the merger with FIGO, and it took it to another level that I believe is going to be so impactful in the future. So thank you. Thank you for everything you've done to provide us this tool.
You're welcome. Thank you. It's truly an honor and blessed to be working with all of you and knowing, like I always say, if the 3 of you can do it in your communities, in your settings, in the number of ways we heard, what's anybody else's excuse, right? We can all do it. We can make this happen and make this change to respectful, safe, equitable care for all. So thank you. And thank you to everybody. We really look forward to hearing your voices and having you join us.